Have you ever wondered if the subtle changes in someone's behavior might be more than just a passing phase? Come along as we unravel the complex web of feelings and actions that frequently go unnoticed, the quiet pleas for assistance that may indicate a more serious issue. This video delves into the depths of the human psyche, illuminating the 10 biggest signs of depression you need to recognize by navigating through the shadows. Join us as we explore the intricacies of mental health, equipping you to serve as a ray of hope for both yourself and those in your vicinity. Number 1. Understanding the complexity of depression. It's similar to figuring out a maze of feelings, ideas, and physical reactions when trying to comprehend how complicated depression is. This complex mental illness is more than just depression. It is a wide range of symptoms that combine to have a significant negative effect on a person's overall health. Depression can appear in many different ways, ranging from ongoing depressive symptoms to cognitive deficits that interfere with decision-making. It changes appetite, throws off sleep cycles, and leaves one feeling extremely tired. Understanding the complex layers of depression is essential to promoting empathy and support, helping people realize the severity of this problem, and opening the door for successful intervention and recovery. Number 2. Persistent sadness and emotional turmoil. One important aspect of depression is persistent sadness, which goes beyond the momentary blues to become an enduring emotional backdrop that permeates daily life. This deep sadness frequently combines with emotional upheaval to produce a complex tapestry of psychological suffering. People who are depressed often find themselves navigating an unending sea of sorrow, with even the smallest waves feeling overpowering. This ongoing sadness is accompanied by emotional turmoil that exacerbates the struggle, making everyday tasks difficult and overshadowing happy moments. Understanding this combination is essential for individuals who are depressed, as well as those who want to assist them in their recovery. Number 3. Loss of interest in pleasurable activities. A poignant indicator of depression is a loss of interest in one's pleasurable activities. This characteristic sign is more than just apathy. It sends people into a condition where they no longer feel happy doing things they used to enjoy. Hobbies and social interactions lose their vibrancy and become tinged with a pervasive emptiness. This retreat from pleasurable activities strains relationships in addition to impeding personal fulfillment. Understanding this fundamental component of depression is essential because it encourages people and the people who support them to address the underlying causes and pave the way for regaining the joy in life that depression tries to stifle. Number 4. Changes in sleep patterns. Sleep and depression are closely related, upsetting the delicate equilibrium between wakefulness and rest. People who are depressed frequently have major sleep disturbances. These might include chronic insomnia that prevents them from getting the comfort of a restful night's sleep, or, on the other hand, an overwhelming desire to curl up for extended periods of time in bed. These adjustments may intensify the psychological effects of depression, creating a vicious cycle that heightens the feeling of hopelessness. Comprehending the subtleties of how depression affects sleep is essential because treating these patterns becomes a critical component of all-encompassing mental health treatment. Number 5. Appetite and weight fluctuations. Anxiety and swings in weight are typical signs of depression. Those who struggle with this mental illness may notice substantial shifts in their eating patterns, from excessive overindulgence to appetite loss. These variations may have an effect on one's physical and mental health by causing discernible weight changes. Since it sheds light on the condition's holistic nature, knowing the connection between depression and these dietary changes is essential for early detection and treatment. Number 6. Fatigue and decreased energy levels. Depression frequently coexists with fatigue and low energy, which negatively impacts day-to-day functioning. People who struggle with this mental illness frequently experience persistent exhaustion that surpasses normal fatigue and a loss of energy. Reduced energy has a profound effect on every aspect of life, making even the easiest tasks more difficult and impeding productivity. Since addressing the underlying emotional aspects becomes essential to regaining a sense of vitality and well-being, Understanding the connection between fatigue and depression is critical for both self-awareness and effective support. Number 7. Difficulty concentrating and making decisions. Depression frequently covers the cognitive landscape with a thick mist, making focus and decision-making difficult. People who struggle with this mental health issue usually experience a persistent sense of doubt and self-doubt clouding their minds. It becomes difficult to concentrate, and even the most basic decisions can feel like navigating a maze of contradicting ideas. This inability to focus has a significant influence on day-to-day functioning, rather than being a transient distraction. By delving into this facet of depression, we hope to shed light on the difficulties experienced by those who are impacted and underscore the significance of comprehending and aiding those who are dealing with cognitive difficulties. Number 8. Feelings of worthlessness and guilt. Suffocating guilt and worthlessness are common feelings that engulf people in the grip of depression. Pervasive feelings of guilt and inadequacy become a sneaky companion, warping views of one's own worth. Individuals suffering from depression might become stuck in an unending loop of self-talk that is critical of them, believing that they are inherently unworthy. Whether it is justified or not, guilt is a heavy psychological weight that exacerbates emotional distress. It is imperative to acknowledge and manage these emotions, as they serve as poignant markers of the profound influence that depression can have on an individual's sense of self and mental health in general. Number 9. Physical aches and pains. Depression frequently has physical manifestations that are difficult to explain, such as aches and pains. Even though they are less well known, these physical symptoms are important markers of mental health. These physical symptoms, which can include headaches that don't go away, tense muscles, or overall discomfort, are concrete indicators of the profound effects that depression can have on the mind and body. Having a comprehensive understanding of these symptoms is essential to providing mental health care. Number 10. Thoughts of death or suicide. Suicidal or death-related thoughts are perhaps the most urgent and serious indicators of depression. When someone thinks about these deep and upsetting ideas, it indicates that they need assistance and support right away. One should never brush off such ideas lightly. It is imperative that individuals impacted and their loved ones seek professional assistance as soon as possible in order to establish a lifeline that can promote healing and recovery. As we come to the end of our investigation into the complex subtleties of depression, we hope that you have gained important knowledge. Establishing empathy and support starts with identifying the warning signs. If you thought this video was insightful and thought it could have an impact, please think about giving it a like, subscribe to our channel, and forwarding it to your friends. Your deeds might be the starting point for someone's recovery. Remind yourself that you're not alone, and being aware of the warning signs can help to build a compassionate community. We appreciate your participation in this crucial conversation regarding mental health.